Hello everyone, this is Dr. Arshia, and this video is about the gain of function and also the upcoming pandemic, because there are lots of discussion from the WHO, the pandemic X in the future. Mr. Gates also is highly active in this area. So I just wanted to make these two videos just for your own entertainment. I'm highly believe in vaccines. In fact, I'm gonna go get my TB vaccine next week, and I have nothing against vaccines, especially the vaccines that they have proven to be very effective. So besides that, I already have made video regarding chloroquine and also regarding chloroquine and ivermectin before, that there are some studies that shows that they have some effects against certain viruses. And so overall, I think it's good to watch this video and kind of entertained about what different people say and different opinion that they have. And I hope you enjoy this. Please watch it till the end if you are interested in your life and your own family happiness. Please watch.
Anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus.
If we get an airborne pandemic, if we haven't built ahead of time some structures to deal with this, millions of people could be adversely impacted.
But also there will be a surprise outbreak. The next administration, that there's no doubt in anyone's mind that they will be faced with the challenges that their predecessors were faced with.
Pandemic prevention and preparedness is going to end up being, whether the administration likes it or not, a priority.
Yet again have another pandemic, and it is almost inevitable that we will have another pandemic.
Welcome to Event 201.
Of what's looking like it will be a severe pandemic.
A new coronavirus.
Why don't we blow the system up and then say, hey, everyone in the world should get this new vaccine we haven't given to anyone yet?
But it is not too crazy to think that an outbreak of a novel avian virus could occur in China somewhere. We could get the RNA sequence from that and print those vaccines on a patch and self-administer.
The new thing, he's off the COVID vaccine. He already cashed in his stock for the COVID vaccine. He made $500 million off his COVID stock for the vaccine. While you got locked down and weren't allowed to go to work and make money, he bought $55 million worth of stock that went 10 times in value. And now watch the next thing he says, because he just cashed in that stock. So the new thing is nasal COVID thing, because it blocks the infection. But watch this.
We also need to fix the three problems with vaccines. The current vaccines are not infection blocking. They're not broad, so when new variants come up, you lose protection. And they have very short duration.
So now he's shitting on the vaccine, and now he's pushing this new thing. Because I was like, well, he cashed out his stock on the vaccine, and now he's invested in this new thing. Is he invested in this new thing? I don't know. Let's look. This is the Economic Times Industry Gates Foundation to fund 2 COS for vaccine research. 2 companies, is that what that is? For vaccine research. New Delhi, Bill and Melinda Gates Foundation will fund 2 Indian firms, Serum Institute of India and Bharat Biotech. Wait a minute. That's the people doing this.
She went to the ER 9 times and was hospitalized 3 times for a total of 63 days. Maddie experienced over 35 adverse events. In the EUA amendment, Maddie's adverse reaction was reduced to 5 lines that they claim was eventually diagnosed as functional abdominal pain. It's a stomach ache. Does your child, when they have a stomach ache, does that put your child in a wheelchair? Does your child's stomach ache require a feeding tube?
I've got a quick question. Obviously, we invited the CEO from Pfizer or some representative from Pfizer. Nobody showed up. Pfizer has to be aware of you. Have they reached out to you?
Neither Pfizer, the FDA, or the CDC has ever talked to us or attempted to. We have never heard anything from them.
Why did they call ivermectin horse paste?
Because I think they thought that we were stupid.
Well, my next question on that is, isn't penicillin given to horses as well?
Commissioner, that's a very good question, because penicillin, when it first was discovered by Sir Alexander Fleming in England, it started being used without randomized controlled trials. But penicillin literally saved hundreds of thousands of lives on the battlefield in World War II before there were randomized controlled trials. Now, in the case of ivermectin, not only were there randomized controlled trials that showed huge benefit, there was also observational studies that showed benefit. There were prevention studies that showed benefit. There were some studies that did not show benefit, but the point I was making in my testimony, Commissioner, is that this is a completely safe drug. Absolutely safe. In medicine, we speak of therapeutic range. In other words, the difference in dosage between the minimum effective dose and the maximum dose which causes toxic reactions. And the therapeutic range in ivermectin is very wide. It's safer than Tylenol. So why not use it?
The reason I'm sitting here before you today is because there was a patient who had early SARS-2, and she was well enough to go home, which meant I, as the ER doctor, could prescribe something for her. She wasn't going to go upstairs. I prescribed hydroxychloroquine and zinc, and I think I gave her Zithromax as well, and I didn't think anything of it. I happened to call her 2 days later. She was doing great. It was my first one. I got a phone call that I was going to be fired if I ever did that again. And I was stunned.
Who was the call from?
The call is from it came from the CEO of the hospital, who told my medical director to call me. And I said, what's driving this? And he said, I don't think it works. I said, no problem, don't prescribe it then. You practice as an individual, as do I. But why do you care what I'm practicing? I'm prescribing my patient. He said, well, you know, there's a big insurance company. It was Kaiser at this hospital, and Kaiser put their foot down and told the hospital not to prescribe hydroxychloroquine.